Hello, everybody. I'm Howie Hawkins. I was the presidential candidate of the Green Party and the Socialist Party in 2020. And this podcast, Green Socialist Notes, is about continuing to educate and advocate for the eco-socialist program that we ran on in 2020. And there are a million things going on with the Trump administration we could talk about. But today we're going to talk about public health with Sam Friedman, who is a research professor at a leading New York university. He was previously director of the Institute for Infectious Disease Research at the National Development and Research Institutes in New York City. He is the author of over 500 publications on HIV, COVID-19, sexually transmitted diseases, drug use epidemiology, prevention, and harm reduction. And he's also a lifelong social activist, longtime socialist. He's published on social justice topics in about 80 publications on the workers' movement, how we might create socialism, political economy, racism, social movements, including Teamster Rank and File, which came out in 1982. I read that as a Teamster, I think one of the best books on the Teamsters. And what happened in Ukraine. He's been in Ukraine a lot, and he wrote about what happened around the Maidan Revolution. And we'll put a link to that article in the chat at some point here. And as I said, Sam's worked for many years with Ukrainians on public health with respect to HIV, AIDS, and drug users and sex workers. He's also a widely published poet, including 2 books on poetry, Speaking to Make the World Anew and A Precious Residue. And we're going to put a link to that latter, which has more biographical information and some of his publications on social issues. So with that, Sam, why don't you just talk about, public health, even before Trump, the problems we've had in this country and, what's been going on since the COVID pandemic and so forth.
Sure. Thank you for that nice intro, Howie. If you look at any of a lot of indicators of public health, the United States has been underperforming for many years. It has had far higher mortality rates than other relatively economically prosperous countries. It has had far higher maternity, and neonatal, that is to say, young children, in the first year of birth, mortality rates than other relatively economically prosperous countries. It has had sky-high increasing rates of overdose deaths, although they're currently in a little bit of a downturn, and we're hoping it stays going down. But they're higher than anywhere else in the world. The only country that comes close is Scotland. And as anyone can tell you, during the pandemic of COVID-19, our mortality rates were, I think, the highest in the world, certainly one of the 2 or 3 highest. And among developed countries, the only country I think that came close was the United Kingdom. And in part, that's because we woefully mishandled the pandemic. Both the Trump and the Biden administrations did horrible jobs in many ways. The only good thing Trump ever did was push through the vaccine, which then he kind of repudiated, and sowed all sorts of misconceptions about that pandemic and how to deal with it. The United States lacks a national health service of any kind, or even national health insurance, which results in millions of people going undertreated or untreated, and we're going in late to the hospital, so they die, and meanwhile in COVID, we're infecting other people. The hospitals are woefully underfunded, and although the higher levels of the hospitals are woefully overpaid, um, they're terribly understaffed. There was a strike locally in New Brunswick, New Jersey, about a year and a half, 2 years ago, whatever it was. And I walked on the picket line about 20 times with the strikers. It was a 5-month strike, and heard all sorts of horror stories about how understaffed intensive care units and emergency rooms and all the other sections of the hospital were with nurses. And just the last few days, I had somebody in the family in the emergency room, and I spent time with them. And I watched nurses running between patient and patient because they were so woefully understaffed. So you add all that stuff up. And although the US has been a leader in public health research and in medical research, and in fact, one of our main industries, which is pharmaceutical, big pharma, as they say, is based on that research. In terms of actually getting the benefits of it for the people in this country, it doesn't happen. Now, why? Part of it is because the medical system is horribly messed up, but part of it is because what's called the social determinants of health, which a lot of people look at as income inequality, racial and ethnic inequality, and stuff like that, tends to be the more unequal you are, the higher the death rates are in a range of countries. Now, that's a statistical association, but people have studied it at great length. And it seems to hold up and is probably a causal relationship. The only kind of hesitancy I have in saying that income inequality causes higher rates of death is that the people who do that research don't look at what is it that causes the higher inequality. The other aspects of class power, ruling class power as compared to working class power, or white power as opposed to black, Latino, red, yellow power, you name it. And those things may be part of the causal chain as well as the income inequality. But in any case, the kinds of changes that eco-socialists are talking about, that socialists are talking about, obviously go in the direction of reducing that. Now, the other thing, kind of as an introduction that I want to talk about, is that we're in an age of pandemics. When I first got into public health in the 1980s, it was to help fight the AIDS epidemic, which was a pandemic and still is a pandemic. And there have been about 10 or so pandemics since the beginning of this century. Now, most of them don't go that badly. They get all to a number of countries, which makes them pandemic by the definition, but they don't become what I call a mega pandemic, like AIDS or COVID, which kills tens of millions of people and potentially can kill more. We came close with SARS in the early 2000s, but we were able to control it, partly because we had good public health resources. And given the competitive pressures of capitalism, particularly under conditions of declining prosperity in capitalism since the 2008 Great Recession, the businesses and the business owners save money and increase profits and hold profits to a rate that keeps the system going, in part by cutting back on all social services and public health services. And around the world, the public health services are being, woefully unprepared. I mean, the fact that in the United States, when COVID hit, there were no face masks to protect the health care workers to speak of. They were having to use plastic bags to try to protect themselves from a virus. They were taking job actions and things in order to get what's called personal protective equipment, most importantly masks, but other stuff too. Now the roots of pandemics heavily lie in capitalism. What capitalism has been doing, and it's a huge ecological issue, is encroaching upon wild territory. People tear down forests to build new housing. They tear down forests to build factories to create plastics based on oil or whatever that then pollute the environment in various ways. The production of food like chickens and beef and pigs is heavily done, and ducks in some areas, is heavily done in industrial farming where you have a lot of animals which have very little space to move around. They're miserable. They spend miserable lives. And because they're so closely together, viruses and bacteria spread amongst them very rapidly and quickly and can mutate quickly, because the more viruses you have, the more opportunities for the virus to mutate to become more dangerous. So that, for example, with bird flu, which is potentially a horrible pandemic, but we don't know what form it'll finally become transmissible from human to human. But it's all over the chicken and cattle herds currently, which means a lot of opportunities for the virus to mutate because there's just a lot of virus out there. It's becoming a problem with outdoor cats who have transmitted it to human beings. It still doesn't seem to be human to human transmissible, and the hope is that it either never will be or will come in a form which isn't terribly dangerous. But we don't know that, and all the signs are bad. Now, the basic thing is when species are together, the viruses can transfer among them, and when they do, it usually leads to mutant forms doing it, which leads to different forms of the virus in different species. And any of them can mutate, particularly if they're in things like chickens and pigs and cattle, to infect humans. So you've got situations, for example, that CDC has studied extensively in parts of China where you've got big herds of ducks, basically in relatively confined situations, with wild birds flying over them, pooping, and it lands among the ducks, and it can transmit diseases. So one way or the other, capitalism breeds diseases and pandemics potentially. In addition to that, and by the way, HIV/AIDS itself started hitting humans and became pandemic in the process of French and Belgian imperialism conquest of Africa and converting it to their economic value. And that's how the virus got into the big cities in East Africa, where it mutated to become extremely infectious. One other thing I should say, since it's a big public issue around COVID, is, there's been a lot of argument. Is it a wild bat virus that went through a market in Wuhan and then got into people and infected, went around the world from there? The alternative hypothesis, which the Trumpies seem to favor, is that it was a virus in the bats, and some scientists brought it back to a laboratory and used it to learn more about the virus, potentially even for military reasons, and that's part of the reason for gain-of-function research. And then it got out of the laboratory and it infected people and spread. Now, lots of people spend a lot of time arguing about that difference, and it's an important one. It does have some impact. But the critical thing is both of them are due to capitalism and to imperialist capitalism. The military uses or the other uses of things, it's all being driven by capitalist dynamics in the largest sense of the word. Let me stop there for a minute to see if Howie has some questions or other, either about what I said or other questions.
I don't have any questions about what you said. I don't know if you want to get into the harm that the Trump administration is doing with respect to public health, or talk more about the pandemics. I know you've been worked on harm reduction with respect to AIDS, so I'll let you.
Yeah, I should talk about AIDS a little bit.
Okay.
AIDS hit the United States in the mid-70s. In the form of infection. It takes time for the infection to manifest itself as active disease with HIV, but by 1977 or 78, the people who inject drugs knew there was a new infection around. They called it walking pneumonia, and it was killing them. And people, in some of the researchers who studied the health of drug users, knew about it by 78 or 79, but no one paid attention to them because they studied drug users. Who cares, right? Particularly, and those were heavy drug war days, and it even got hotter as a drug war as the AIDS pandemic blew up. Now, it also was present in the early years among gay men, but we have a little less information about that. At least I do. It was, quote, discovered by science in 1981, and very little was done for the next 5 or 6 years by the federal government. Some other countries were beginning to take it seriously, but it was hitting the US pretty hard. And I've been told that Reagan, who was the president at the time, never mentioned AIDS for years in public. Whether he did it in private, who knows? And around 86, they started worrying. There was evidence, particularly from Africa, that it could spread among heterosexuals or heterosexual sex. So they began to take it seriously, and they started to throw some serious money at it. In terms, for example, I was involved in a 61 project, hundreds of $1 million study of HIV prevention among people who inject drugs, which was funded at that time. It was interesting. In 1987, the beginning of 87, when they funded it first, they were willing to fund projects that were really street-focused, community-focused, working with the drug users and the people focused because they were scared. 6 months later, when they began to back off their panic, they were still funding the research, but it was increasingly under terms of randomized controlled experiments and more normal science and less community involvement. And as it went on through the 90s, as they kept funding new projects, the budgets went down and the degree of originality and community focus went down. Now, in the meanwhile, in other countries, namely particularly the Netherlands, but then England as well, the United Kingdom, they began to set up things called needle exchanges as a way of preventing the spread of HIV among people who inject drugs. And in the United States, mass movements of gay men broke out around HIV/AIDS because it was killing a lot of them. They had a certain amount of organization and clout by that time because of the gay liberation movement. And they were able to, in particular, to force the U.S. government to start funding serious research towards preventing, towards medicines to prevent the disease or to cure the disease. Let me talk about the harm reduction movement for people who use drugs. I was a relatively early member of that, both in the U.S. and internationally. The government refused to fund syringe exchange in the 80s and through the 90s. They would talk about how it would do more harm than good, even though we had all sorts of data from the United States and other countries showing that it wasn't doing any harm, it was doing only good. I did research myself that showed that places, that needle exchange reduced the rate at which drug users got HIV in New York to 1/3 of what it had been before the needle exchange was set up. And the idea that punitive approaches, arresting drug use, works. I did other research which showed that among 96 metropolitan area, where you had higher arrest rates for hard drug use, you had more HIV. Among those who got HIV, you got a higher number who went on to AIDS, and among them you had a higher number who died. And there was no evidence that arresting drug users reduced the number of people injecting drugs. So that the simple argument is that arresting people does harm in a lot of ways. It kills people, and it doesn't reduce the amount of drug use. Now, all this research was being developed and stuff like that, and things were being shown. Neither the Reagan administration, the first Bush administration, or the Clinton administration funded syringe exchange, even though it was a self-evident public health necessity. And in general, it was not really until 2013, with the outbreak in Scott County, Indiana, that people in the government started taking harm reduction as something serious. That is, the system in the United States is cruel. It is willing to let people die. Now, other countries did much better, some of them, not all of them. They had programs up and running. By the end of the 90s, it was quite common to have government-funded syringe exchanges just accepted. The first time I went to Australia, which was, I think, in 1993, it was to a harm reduction conference. And what struck me through my jet lag most about that conference was the extent to which people were presenting results on the how good harm reduction was and needle exchange was with the same kind of course, it's just business as usual, as they would on other programs like drug treatment programs and stuff. So that in other countries it had been simply normalized, and in this country even now it's attacked. It's part of the and one of the reasons I've always thought that that's partially true. In addition to the racism that means that drug use can be scapegoated and used in a way of scapegoating blacks and Latino people. That an additional reason is the lack of a national health program. If people who use drugs, or gay men for that matter, get AIDS and die, it doesn't cost the government any money. So, why should they care? The system is cruel. And let me hand it back to Howie for more questions.
Well, I think part of the cruelty of the system we've witnessed in the wake of the peak of the COVID pandemic is the way the Biden administration sort of cowered before the Republican-led demonization of things like masking and other public health measures. So maybe you could talk a little bit about that, and then what we're now getting from the Trump administration, which is basically, from what I can see, defunding, hiding research, wiping out websites, and so forth.
Okay. The problem with COVID was totally mishandled from the very beginning in the U.S. The thing that everyone talks about, and it was giant, was the failure to make testing for the virus, the SARS-CoV-2 virus, widespread and readily available at the beginning of the pandemic. We went months without an easily available test. You may remember people lining up in cars for vast pile-ups of cars in order to get the test. And that was once they got the test available. Part of the problem there was that the Trump administration had appointed somebody I've had a very low opinion of since the early AIDS epidemic to be head of CDC, a guy named Redfield. But more fundamentally, the system was underfunded and arrogant in the sense that it felt that if it wasn't an American test, it shouldn't be used. There were good tests overseas, but they wouldn't go for it. And that's just the first example of mishandling. Then there's all the garbage about, horse medicine as a treatment and stuff. They did intelligently put a lot of money and effort into developing a vaccine. But then when the Trumpies had actually funded the development of the vaccine, they attacked it in various ways. And of course, people like R.F. Kennedy Jr. has been attacking vaccines on totally wrong-headed grounds for decades. Meanwhile, a bunch of truly reactionary groups who were Republicans or to the right of that started attacking masks. Now, it's got to be said, the left had a wing of it who went along on the vaccines or the horse medicine and even to some extent the masks. One of the things that happened during 2021 to 2, if I remember right, is a lot of arguing back and forth on the left about vaccines, and people pulled up all sorts of really rotten studies that claim to have showed that vaccines were killing mass numbers of people, which simply isn't true. I mean, it is true that there are a certain number of people who have a bad reaction to the COVID vaccines. I work closely and just published an article on pandemic futures, and before that one on long COVID, with somebody who has long COVID symptoms and was one of the people who had a bad reaction to the vaccine. And if you read the warnings, they tell you one person in some huge number has a bad reaction to vaccines. It's true of any vaccine you want to tell about. There's always a few people with odd reactions, but they test them to see the magnitude of those reactions. And compared to the number who would have died or gotten long COVID as a result of the pandemic, the vaccines were very protective. But nonetheless, on the left, there was a faction. I remember holding a coffee house in the central New Jersey area where we were discussing the COVID pandemic and how to deal with it. And we had people reading essentially nonsensical articles about horse medicine in a monotone, who wouldn't shut up. We had others who were talking about the evils of vaccines, and other people were presenting exactly how absurd that was. We had one of the leading infectious disease doctors in New York City presenting the science against it, and they just wouldn't listen. So now we get to the Biden administration, and starting about shortly after they come into the White House, they start backing off from all the pandemic stuff along the lines Howie was saying. Now, it's not a question of their caving in to the Republicans only. Their focus, like all capitalist administrations, is getting big business up and running so the profits are going. And they basically made decision after decision as to, quote, open up, which had the effect of getting people back to work, which had the effect of getting kids back to school, and which had the effect of increasing profits for the companies. And when people go back to work, it's easier to control how they work and to make them overwork. So that helps to increase the profits. And the result was, for example, when the Omicron wave hit, everyone is saying, who cares about this pandemic anymore? It's over. It was officially over. And a lot of people, thousands of people, for a while there, it was thousands a week were dying in the United States. And heavily because of that decision. Now, what is also clear is that my own take on it, and I may be wrong here, is that the vaccine has led to the virus mutating into a form that may be increasing the extent to which long COVID becomes a problem. And I recently read an article out of the Recover study, which showed that somewhere between 10 and 26% of, I think it was people who had had the virus at some stage, had long COVID, at least for a while. Now, some people, it seems to be years, maybe the rest of their lives, that they have it. And the more times you get infected with the virus, the more likely you are to develop long COVID. So then we get to the Trump administration. What can I say about them? They're putting the wrecking balls in charge of everything, or they're trying to. If we fight back enough, they may be held back. The Senate confirmed this week R.F. Kennedy Jr. to be the head of Health and Human Services. This is a man who doesn't believe in vaccines. The sole Republican who voted against him, McConnell, who was himself a Republican right-wing stalwart for years, and a lot of friends of mine in Kentucky, where he's from, hated the man, was the only person who voted against confirmation because he had had polio as a kid. And, Kennedy has come out against the polio vaccines at time, although I think nowadays he's saying he supports it. But he's generally done everything he can to convince people not to take vaccines. I read today that there was an outbreak of measles, 20 or 30 people, probably kids, I don't know, got measles in Texas just in the last few days. I had measles as a kid because I was a kid before the vaccine. I had a fever of 106 degrees. That's hot enough to burn off some brain cells. I've often wondered how smart I might be if I hadn't had that measles bout. He wants kids to go through that. I mean, he doesn't want it, but he thinks that it's better than the alternative, which is taking the vaccine. I read today that because of Trump's decision to essentially fire all the people who are probationary employees in the federal government, that 10% of the CDC workforce was being let go. Now, when COVID came, the CDC was terribly understaffed. I can tell you that from my work with AIDS and other infectious diseases. Now they're cutting it by 10%. In addition to which, they're putting another incompetent in charge of CDC, I believe. It means when the next pandemic hits, say bird flu, they're going to make stupid decisions. They're going to be slow. They won't have the staff to do it well, even if they want to. Let me return to what I talked about early in this talk. When my relative was in the hospital, in the emergency room, and I saw all those nurses running and other staff running around, totally overbusy, not able to do the job they should be doing. During the pandemic, it was much worse. During the next pandemic, it will be much worse. And they're talking about gutting the hospital budgets by cutting back on Medicaid, by cutting the indirect cost rates on research to 15%, which means not just that research is going to be cut back, but that's a fairly sizable hunk. I heard about one major hospital system in New York where the indirect costs are 25% of their budget. And that goes for administration and stuff like this. It's to pay for the labs, it's to pay for the professor time of the research professors. Professors have to do research to keep their jobs and also to help medicine so people are kept healthy and can get protected. Like if there's a new virus, what are we going to do to protect people? You need people to do that research. And that's what they're planning to attack by cutting the 15%. to have lab animals to do the research on to develop a medicine or a virus or a vaccine costs money, and it costs overhead money. And they're cutting from 50, 60, 70% down to 15%. That means there is going to be lack of lab animals. There's going to be lack of professors and research staff. And it will also start cutting back on medical education. So if people have dreams of their kids becoming doctors, well, who's going to teach them when that happens? It's going to, and will the teachers know as much? The answer to that, of course, is no. So that's part of what is being attacked by the Trump administration. It means, and God only, I have no idea what they're going to do about overdose. Their changes in social, economic, and political policies are going to tend to drive the overdose rate up, I think. It's going to make more communities of despair around the country. They're in the process of creating a recession by firing all these public workers and all the hospital workers who won't have research or jobs because of the cutbacks in hospitals and the Medicare and Medicaid and all that. And they're probably going to create a recession by doing this, maybe a depression. That's going to create more communities of despair, like the Rust Belt has been. And that's going to create more alcoholism, more suicides, and more overdose deaths. Let me toss it back to you, Howie. I need some more stimulation.
Okay, well, we got some questions in the chat, but before we get to them, if you could briefly talk about the international impact of freezing foreign aid, particularly for health programs, like in Ukraine where you've worked, in South Africa. Say a little bit about that.
Yeah. South Africa had the worst AIDS epidemic in the world and still has a bad one. And so I've been working with people in South Africa and some of their prevention and care efforts. So far, the research is still ongoing, as far as I know, but a lot of the care efforts and medical efforts have stopped. And that has led to staff becoming unemployed. The people those staff would have helped to get into medical treatment, like by giving them HIV tests, would not get into treatment. People are going to be dying. The estimate is that PEPFAR has kept 26 million people alive. That's people who are infected with HIV, or when they're taking antiretroviral medicines, able to live relatively normal lives. But that program and the medicines have been funded by PEPFAR, which is part of USAID. And it's been one of the few, it's been a helpful program by the United States government. It's been a big public relations success, I might add, for the US government. And we're going to see millions of people die if it gets cut off. Now, it's going through the courts and it gets paused, it gets reinstated. At the moment, a lot of the programs in South Africa and Ukraine have been reinstated, but, the cutoff of USAID is impacting all sorts of income support programs for the poor. It's cutting off all sorts of other medical programs. It's going to do incalculable damage. Even though it's also true that USAID, like most U.S. foreign aid programs, has had terms to itself that lead to more business in the U.S. by corporations, big pharma, big agriculture, whoever the AID program is paying for medicine or food, a lot of that has to be sourced through the United States. So cutting off USAID is going to cut off that business. One of the reasons I suspect why there's going to be, there is big pushback against cutting off USAID, even at the government, even at the court level, but also I think the lobbyists for big pharma are probably saying, you're cutting heavily into our business here. Quit mucking around. South Africa and Ukraine, both are places I've done a lot of AIDS prevention research and other work in, are of course two places that Trump seems to hate. And, I really fear for what he may do to them, both economically and, in Ukraine's case, militarily, and also in terms of providing public health assistance for things like HIV. Or, wounded veterans who need a lot of care. Some of that has been been provided for Ukrainian soldiers by the U.S. government. That's, they're trying to cut that off if the courts allow. And maybe even if the courts don't allow, because this government doesn't, lots of cases that I hear about, kind of anecdotally, where the courts have ordered stuff restored and people can't access the money, so that they can't keep the programs going, both in the U.S. and abroad. So the general picture there is pretty horrible. And the cruelty. I mean, this is all an attempt to make U.S. business more profitable and do well, and to increase the power of the United States, at least in the fantasy life of people like Trump and Musk. And what it's going to do, of course, is weaken the U.S. imperial thrust. On the other hand, they seem to be very happy to increase, or at least maintain the flow of weapons to Israel. They want to convert Gaza to a resort area for the Trump industries, I assume, and his allies. And to hell with the people who live there. I mean, we've seen the utter cruelty the Biden administration showed towards the Palestinians, and for that matter, the Lebanese. And it may be even worse under Trump, though that's hard to imagine. And meanwhile, Trump is talking about starting wars with Panama, Canada, and Denmark in terms of Greenland, potentially.
Well, let's take some questions that were put in the chat with the time we have left. Scout Trooper 164, do you believe with the lack of health research that it will cause uproar across the country? It sucks that humans don't care for things unless it directly impacts, but I'm curious.
So am I. It's very hard to predict the future. If they cut back on cancer research, well, that, I think it'll enrage the people with cancer or who know people with cancer. If they cut back on research and overdose, people who use drugs in their families or who have lost people to overdose will get angry. And of course everyone else should too. Over 100,000 people in the United States died of overdose last year. When you multiply that by their friends and relatives, that's several 100,000, maybe 1 million people. If the United States were truly a democracy, that would have some impact. But, the government of the United States essentially ignored public opinion whenever it could in maintaining the Vietnam War as long as it did, and fighting the civil rights movement as long as it did. And national health has been, of one form or another, has been a majority desire, I think, my entire life. And the government has never responded. So that, I totally agree that it's going to take massive battles, strikes, fighting in the streets, you name it, to fight back against this administration, and people should be organizing for that. Next question.
Vicky Corden, too much cutting for Medicare and Medicaid will hurt people. But I guess the regime wants to hurt people, especially poor people.
Well, I remember during the Reagan administration, and then when the Clintons made cuts to welfare, it hurt a lot of people. And a lot of people got mad about that, but the government wasn't responsive to that. The government responds primarily to the needs of capital, usually performs in a racist way in reacting to the needs of capital, but it has two limitations on that. One of them is if people get too unruly and stuff, it has to back down. The other limitation is when that starts cutting into the profits of capital itself. In the early days of the pandemic, they were willing to shut down because they were afraid that the loss of workers would potentially cut into their ability to make profits. It was a real threat to business as usual if you had the kinds of people getting infected and getting very sick and many of them dying that was happening in early 2020. So you could see they shut down. And I wrote an article that was published on the Tempest Mag website talking about, and another article published in the Spectre Journal, which unfortunately is behind a paywall, talking about how you can look at the profits and things and how different countries with different profit needs affected their policies towards COVID accordingly. The current belief on the part of a strident, open racist like Elon Musk is that he's going to replace workers wholesale with artificial intelligence, which would remove the barriers to capital, screwing even more people. I mean, you have to understand, once you're not making profits, they don't give a damn about whether you live or die. The kinds of COVID policies they were saying were, let the pandemic rip, don't bother with protecting people, let it reach its own level of stabilization, basically meant kill off as many old retired people as you can, since more old retired people die than people of working age, and save the government, Social Security, and other kinds of money while letting the workers die at a lesser rate, they hoped. So I totally agree, Vicky. It's not so much that they want to hurt people, but they're indifferent to hurting poor people. People like Elon Musk and possibly Trump may want to hurt people, but most of the people who run this country just are relatively indifferent to hurting people if it's a question of people versus profits.
Well, we put the Tempest article in the chat, the link to it, Pandemic Futures, although the Tempest website is temporarily down, but you can get that. And before we end here, let's put in the other two links to Sam's writings that were put in at the beginning for people who came late. So there was a question up.
Yeah, there was.
Yeah, Ginny, if we hear about the bird flu having morphed into infecting humans, how do we protect ourselves? Masks, gloves? What's the vector? Where will we get good information about these kinds of things?
That's a tricky one. We don't know yet if it becomes something that goes from human to human, which is probably required for a large scale pandemic. We don't know how it will be spreading. We could guess it's a flu, which means it might be transmitting in droplets, but it may transmit in what they call aerosols, which means mini droplets, which travel much further and which fill up rooms and don't necessarily disappear for a while. Masks are effective. People talk about using N95 masks and the best ones you can find against COVID. And that's correct. Hopefully, it'll protect us against the bird flu if it's an airborne disease. And it probably will be. But, it may be transmitting in other liquids, it may be transmitting, so you need gloves. Masks are almost certainly, but, how are we going to know about these things? That's a tricky question. For the pandemic, the COVID pandemic, I get a lot of my news nowadays in scientific publications, but I also get some of it through something called People's CDC, which has a website, or the Sick Times, which is also on the web. I'm not sure if they're open to opening it to everybody, but there is a very good email list called the Spirit of 1848, where serious researchers of a radical persuasion talk truth to each other. Science for the People has on occasion had that, but it's also on occasion not been so effective. There's a lot of disinformation out there. NIH has something called PubMed, which is an open website, and it publishes scientific articles and the abstracts of scientific articles. You might have to teach yourself how to read them. It's not that hard to do, at least for some of them. The question of telling good research from bad research is not easy for anybody. Even when you go to peer-reviewed research, it's better than the alternative, but it's still got a lot of garbage out there. So that I have no tried and true answers for that. Is there another question, or?
Well, Chris is putting them up, so I'm waiting on him.
Or we're coming near the end of the hour, so if you have any wrap-up questions.
Well, usually he puts just my name up there to signal that he may be taking care of his baby, who may be demanding attention. So,
right.
Okay, well, there's your cryon.
Anyway, I thank you for this.
Yeah, and Sam, thanks for coming on. I hope people got a deeper sense of the public health crisis we're in, and your call at the end to resist, by militant means, I think is timely. And I guess the only thing I would add is that we can't rely on the Democrats to be an opposition. They are so meek right now, and it's going to require more radical means. And just to repeat, and I'll elaborate on this more in the future in an article I'm writing, we need independent political action in the Trump era, and it's got to start at the base. We don't have a left that's organized, that's strong enough to really impact the national debate. We got to build that from below and elect people to local office and from their state office and eventually get into the House where we'll have some leverage. And, that will give more strength to our social movements, which I think Sam indicated get ignored when the Democrats can take our votes for granted. So
let me add to that.
Sure.
Even if we have something like a Green Party or other left-wing thing taking offices, that in itself will not be enough. We need mass movements to keep that party honest. I mean, we've seen the Green Party, for example, go a little crazy around the question of Ukraine, where a large part of it didn't understand the need to defend the Ukrainian right to self-determination. They understand it for the Palestinians. They don't understand it for the Ukrainians. And we need to build a mass movement of workers and other people that does understand that and that will take the power away from capital and help us create an eco-socialist world.
Yeah, I completely agree. And I think I said this last week on the podcast that we can demand and actually win reforms like Medicare's partial national health insurance, Social Security, old age pensions. But if the capitalists still have the power in society, when they got the opportunity, they're going to roll these things back, as we're seeing now on a radical scale under the Trump administration, which means you get a reform government in, but the people got to back it up. Capital has extra parliamentary power. It can go on a strike just like workers can go on a strike. And if the workers don't take over the means of production at that point, the capitalists will keep the power and the reform movement will be discredited. So it's a lot to talk about there, but I think you pointed us in that direction, Sam. So I just want to announce that next week is 2 days before the third anniversary of the Russian full-scale invasion of Ukraine. And we're going to have a Ukrainian socialist historian, Vladislav Starodubtsev, who's going to talk about what it looks like from Ukraine now with the crazy stuff that Trump and his minions are saying at these security conferences in Munich. But he's also going to talk about the history of Ukraine's independence movement, going back to the 1800s through the Ukrainian People's Republic during the Russian Revolution, and how the left played a central role in those things. That's his specialty as a historian. So it should be an interesting discussion. So we'll be here next week at 3:00, and we'll have Vladislav, and we'll talk about Ukraine. In the meantime, everybody, I hope, as I've been saying, if you're not in a group organizing resistance, you need to get in a group. We just can't do it online. You got to, being in a group, exchanging ideas makes us smarter and more powerful. So I hope everybody's, doing their part in resisting the crazy stuff that's going on now. And otherwise, have a good week, everybody, and we'll see you next week.